The Republic of Korea, ROK, has the highest number of reported COVID-19 cases outside China. And officials reported at least 505 new cases on Thursday, bringing the total to nearly 1,800. As that number of cases creeps up in countries around the world, fears of a pandemic are on the rise. So why has the ROK been hit so hard? What can countries do together to contain the spread in the interconnected world? We're joined in Singapore by Dr. Victor Teoh, Assistant Professor at the University of Hong Kong, and also in Singapore by Professor Sungwon Yoon, Assistant Professor at the Duke-NUS University of Singapore Medical School.
The epidemic in Korea is getting severe. We feel the same as Korean people are feeling, and we also believe Korea's difficulties are China's difficulties. China is willing to offer necessary assistance to Korea to support the Korean government and people in fighting the epidemic. Therefore, both countries are in close communication.
So, Dr. Yoon, you are a Korean national. Well, the virus started in China, now is spreading in South Korea, your home country. How do you feel watching from Singapore?
Actually, I feel very concerned about the current situation in Korea. Actually, I have friends and family back in Korea, and I try to call almost every day to actually check whether everything is okay. Yeah. And then
are people back in South Korea worried about the further spread of this disease?
Yes, exactly. Yeah, definitely they are very worried about for the spread of the disease at the moment.
As far as you know, what is the main reason for the cluster infection in South Korea? It seems it all traced back to a church gathering.
Yeah, that's right. Actually, the Shincheonji, the religious activity was the major source of the mass outbreak in Korea. Yeah.
And about the government
another
response,
source of the outbreak is
Professor Moon, your president already said this is the highest possible alert, and that means the government can have the power to make drastic changes of its management, restrict public transportation, lock down cities, and close schools. Do you think it is necessary to do all those things?
Yeah. I personally don't think so. Also, I personally think that it is highly unlikely that government will impose such drastic measures in Korea due to political and economic implications. Actually, 2 days ago, the government actually announced that they would roll out a maximum lockdown on the city of Daegu, where the mass outbreak actually occurred. But there was a severe backlash, immediate severe backlash, and also government immediately stepped back and explaining that actually the lockdown was not meant to be physical lockdown. It's more related full-scale efforts to contain the virus.
But do you think the Koreans are underprepared for this? Because as far as the Chinese is concerned, the lockdown of the city, minimum travel, self-isolation did work for Wuhan. That's why the infection rate has been dropping over the past few days. But the South Koreans are not willing to do that.
Well, actually, South Korea has been quite relaxed since the first case actually emerged in January. Over the past 1 month, there was about 28 cases until 20 February. So the government was quite relaxed. But after this Shincheonji, the mass outbreak, the government realized that actually they should do more and then try to make an effort to contain the virus.
And Dr. Teoh, I want your take on this. What is the best way to contain the virus, especially considering the situation that most of those cases that are really bad are happened in cluster of places, like in cruise ships, in prisons, or in hospitals?
Well, I'm no medical specialist, but I would imagine that I personally feel that a tighter control of movements of people and perhaps targeted quarantine of certain sections of the population, and in this case, I think the church members might be necessary. This would be perhaps more difficult to implement in South Korea. And this will be, the situation is quite unlike the Chinese situation. The Chinese government actually has the political clout and the ability to enforce this. But in other countries where people are used to the freedom of movement, and there is less restrictions on the rights of the people, this might not actually be possible. But in doing so, the government has actually to do this through persuasion rather than
if there is a further spike of infection cases in South Korea, because we understand that this disease is highly contagious, do you think it will probably change the mindset of the people and also the policy of the government in South Korea?
Well, as it is today, I think everybody is treating the two infected places like, the population there like pariah. If you read the newspapers, the people in Daegu says that their relatives elsewhere, like in Seoul or elsewhere in Korea, asking them not to attend family functions. So even if the government doesn't lock down the place, these people from these areas are not welcome in other parts of Korea. So you have the social, if you like, a kind of social quarantine, if you like, already taking place in Korea. And I think because of the high risks involved, people are conscious. The South Korean population living in those places are conscious as to what is going on. But by and large, I think the South Korean government has been quite transparent in the way that it's disseminating the information. And because goods and services are still being provided on a continuous basis in these affected areas, I think the panic level in those two areas is kept to a minimal. So I think Korea has a good chance of containing the virus.
What about the hospital preparedness? Because there's the problem in Wuhan when there is a sudden surge of patient demands and overwhelm the hospital system all over the city. Are South Koreans thinking about backup plans if there is a sudden surge of demand? Dr. Teal?
Are you directing the question at me?
Yes, Dr. Teal.
Yeah. Yes, I think, no, to be honest, I don't think there is actually a country that can be prepared adequately for a scenario like this. Even in places like Singapore and Hong Kong, we're seeing difficulties at the beginning when this thing broke. South Korea has had, I would say, a couple of weeks at least or 3 weeks of seeing what's happening in China. So they do have the benefit of, I'm not sure whether you can call it hindsight, but they certainly have learned what's happening, what could be done to contain, and as best as I could tell, the South Koreans are handling the situation pretty well.
And about the relationship between the three countries that have been bothered by this problem, China, South Korea, and Japan. The Chinese State Councilor and Foreign Minister Wang Yi commended the ROK for its robust and swift response. Well, he said the ROK's difficulties and China's own difficulties. How do you like the possibility of cooperation between China and South Korea in terms of combating this new virus? Dr. Teal?
I think each country has their own unique circumstances. And it will be certainly in both countries' benefits and interest to cooperate. After all, China has spent the greater part of the last few weeks on combating this virus. And as at today, we are seeing that the Chinese do not have incremental spikes, which means that they are getting a handle of the situation. Certainly, the South Koreans and the Chinese could actually communicate and talk more about what could be done, although, of course, the measures they implement are different. One of the things I think the South Koreans have done really well is to contain the panic by keeping the cities open. So in that sense, the South Koreans are also studying what the Hong Kong government and the Singapore government has done. It will be definitely in South Korea and China's interest to cooperate, because even if China manages to clear up everything within China or reduce the cases, there is always the risk that the outbreak in Korea will worsen the situation in China and vice versa. So it will be in the best interest of the countries to really cooperate and do whatever they can to make sure that the infection stops. I mean the epidemic stops in all countries and not just in their own country.
Dr. Yoon, you are now in Singapore, also has seen a lot of cases of this new virus. How do you think those Asian countries that can work together in terms of information, logistics, and materials?
Actually, I'm not sure how exactly the Asian governments should work together, but as you can see, previous outbreaks, for example, bird flu H5N1 and H1N1, and also SARS, you can see that Asian countries are actually the source of the epidemic rather than offering some insights for the prevention of disease. So we might need to actually work together to share the information, and we need to have some governance mechanism to actually collaboratively work together and to control the outbreak.
And Dr. Teo, the new development is that the Beijing officials have announced there will be tightening restrictions on international travels. That means travelers will need to undergo 14 days of self-quarantine coming from other countries, including South Korea, when they're coming to Beijing. Do you understand this?
Yes. Hello?
Yes, Dr. Teo?
Yes, for sure. I think this is the case to prevent the importing of cases from abroad. Right now, they are trying to stem the source of this infection, and when the epidemic broke out, a lot of countries imposed travel restrictions on the Chinese. So right now, the Chinese are doing likewise to countries which are seeing the spike in the cases. So it's understandable, and I think what the Chinese government has to do is to explain to the Japanese and the South Korean governments, as well as maybe to Iran, that it's actually doing it's an understandable policy to try and tame this thing. So it's not targeted at a particular population per se, really, but these policies are justified on medical grounds.
1 minute left. Do you foresee the possibility of a global pandemic of this virus? Dr. Teo and Dr. Yoon.
I think the horse has already left the barn, so we are now seeing the thing moving across. So many specialists are saying that it's not a question of if, it's a question of when, and I think I agree with the assessment. Dr. Yoon?
Yes, I also agree with the assessment. And actually, we have been discussing about this pandemic public health emergency declaration by the WHO. So we are still waiting. So we want the WHO to assess based on scientific evidence.
We're running out of time. Thank you very much, Dr. Teo and Dr. Yoon.